So are you typically going right versus left? Or is it just you just take a look first and decide on the fly?
Decide on the fly. And this is a strange thing to say, but sometimes it's just but a lot of the CT rooms that we use, there's like a bigger side of the room. And so oftentimes I just put the grid on the bigger side of the room. Like, it doesn't matter which side that is for the patient, like however they decide to put the patient in the gantry, but I'll just prefer to work from the big side of the room because I have more space.
Yeah.
Yeah. And if I have to if I decide that kidney is not a great one to biopsy and I have to reach over and do the other one, it's not a big deal. But basically I don't care which side. Like, usually both kidneys are good enough targets to where I don't scan them and then say, okay, let's go for the right one. Usually that's been my experience, that whichever kidney is going to give me some good tissue.
Yeah, definitely with ultrasound, I will look at both kidneys, see what's more visible, what's more accessible. For CT, I tend to go on the left. Usually, like you said, that's the bigger side of the room for our CT rooms, where they're going in feet first in the CT gantry, is it will have more room on the left. But also, I feel like it's a little bit more, maybe because the liver's not on that side, the kidney tends to have a little bit more exposure. There's like a bigger window posteriorly coming down through. And the other thing I like to do is not, if I can help it, not have to go through the paraspinal muscle.
Yeah. Gotcha.
Because in case like they have some, with that needle puncture, they can have a contraction and that can kind of change things, and they can feel it, right? Going through that muscle can hurt. And so I try to stay outside the muscle if possible, but I also like to come straight down on the cortex. So yeah, typically I would say I'm probably 75% left, but sometimes the right is more favorable. So I just didn't know if you had a method to it.
I mean, there's a kind of a method to the madness, but I can't make a strong, I can't even think about whether I'm doing left or right more often. I just kind of pick whatever side. And oftentimes, like you, also just kind of look and I'm like, all right, this is the side we should do for whatever reason, whether it's something else is in the way, there's nearby colon, this kidney happens to just look slightly plumper at the lower pole. Sometimes that's a factor. And I think that's also like kind of a savvy tip for younger interventionalists or trainees, like avoiding that paraspinal musculature. Just for what you said, 2 reasons, pain, and sometimes like if they clench that side, that can kind of redirect your needle in a way that you don't want it to. And then also there's just less play in the needle once you start like getting into muscle. Like if you try and do a redirect and you're in muscle, like it's just a little bit harder to torque it.
Yeah.